This one organ raises cholesterol, but most doctors never make the connection. Here's what's actually happening. For almost 15 years, I treated high cholesterol the same way every other doctor does. Cut the eggs, cut the red meat, exercise more, and when that didn't work, prescribe a statin. Then I met Anna. She was 47 years old, the exact same age her father was when he had his heart attack. When I pulled up her labs, her cholesterol was over 300. And before I could even open my mouth, she said, "My dad did everything his doctor told him. He cut the eggs, took his statin every single day, walked 30 minutes every morning. He did it all for 6 years. And then he dropped dead of a heart attack at 47. She looked at me and said, "So what are you going to tell me that's any different?" And I didn't have an answer. I remember looking at her and thinking, I'm not letting her become another patient I see for the next 10 years, doing everything right and getting nowhere, because she'd already watched it fail. That was the moment I stopped repeating the diet, exercise, and statin playbook and dug deeper into statins, the drugs we prescribe for cholesterol. What I discovered changed everything about how I treat cholesterol now. Statins don't work in the heart or your arteries like we think. They work on a liver enzyme. And that realization hit me like a brick. Because if high cholesterol was really just a food problem, why would the drug target the liver? Then I saw something I didn't learn in medical school. Your liver produces about 80% of the cholesterol in your blood. Your diet only contributes around 20%, which means every time I told patients to cut eggs, cut steak, or go vegan, I was fighting the 20% and ignoring the 80%. That's not bad advice. That's the advice that killed Anna's father, because it's obvious now. Cholesterol isn't a diet problem. It's a liver problem. It's your liver that's supposed to pull excess cholesterol from your blood and flush it out, so your cholesterol stays at a healthy level. But over time, your liver can get overwhelmed. Years of stress, medications, processed foods, environmental toxins clog up your liver with toxins and slow it down to the point it's too sluggish to clear the cholesterol fast enough, so it just builds up in your blood. Even if you're eating clean, it's basically like trying to drain a bathtub with a clogged drain. You can stop the faucet, but until you unclog the drain, the water just sits there. That is the body. The liver is like a clogged drain, and it gets stuck. I attended a medical conference and met a top New York City gut health doctor, Dr. Gina Sam. She confirmed what I was already uncovering and took it a step further. She showed me a simple way to restore the liver's ability to clear cholesterol naturally, without statins, without extreme diets, and without punishing cardio. Just one simple 7-second method you do every morning. It's called the 7-second liver reset. And it works by restoring the body's natural ability to clear cholesterol and toxins from your blood. Anna's been doing it for 3 months now, and her cholesterol levels are normal, energy is back, and for the first time since losing her dad, she feels like she's not just waiting for the other shoe to drop. Dr. Sam breaks down exactly how easy and how simple it is to do. So I put the link to her short presentation below. If you've been doing everything right and your numbers are still climbing, you need to see this video till the end. It's free. You don't have to enter any information or anything. And honestly, I only wish I'd found it years earlier for my patients. So click below to watch Dr. Sam's short presentation and see her 7-second liver reset now.